have to be compassionate to them, make them feel special. They come with a problem, listen to them. We should have the time, even though there are about 10 to 20 patients, you have to give that time. And I had kept a junior dentist. She comes at the end of the month with 2,500 rupees for the entire month.
Oh, okay.
Okay, and that was quite shocking. I mean, I did not know I had to pay my assistants, I had to pay the rent, I had to pay the electricity bill. But what is 2,500? But then you won't believe it. It just started bleeding. It just wouldn't stop. So I tried to put cotton, I tried to put gauze. You just start doing your procedures, start doing well. People by word of mouth, they will slowly come. And after I started my clinic, I think it took me 1.5 years to get my first ortho case. There were many people who came, who inquired, who asked, and then they went back. They did not come here.
Hi viewers, I'm Dr. Prince. Welcome to my channel, Dental Treasures. So let us start our dental journey today. So for this, I was looking for someone who started dental career right from the scratch and who is an active dental practitioner for more than 25 years. So fortunately, I found a right person with us. She is not located in any main road. Her clinic is located somewhere in the interiors, and the best part is she's not enrolled in any digital platform, nor there is any signage in front of her clinic. Yet there is a good patient flow. She lives a happy life. She spends ample amount of time with her family. She's got a lot of time for her hobbies. And also she's compassionate towards her pets. So let us find out more details about her. So as promised, we have our first special guest. So let us start our dental journey with this person. So let me give a small brief introduction about this person. So Doctor has completed her BDS in the year 1995 in M.R. Ambedkar College, followed by which she opened her own practice in the year 1998. And then she slowly shifted to her house, which is located in Maleshpalya, Martinagar, and that was in the year 2012. So let me introduce to you Dr. Susan Alex Thomas. Thank you so much, Doc, first of all, to accept my invitation for this program, Doc.
Thank you.
Yeah. So Doctor, so why dentistry, Doc, out of all the other field? So what made you choose this dental field, Doc?
So actually from my childhood, I wanted to be a doctor. So, I mean, it was, as I was growing up, my passion was to become a doctor, to serve the people, to take care of them, to take care of the ill. So, but after my 10th and my 12th, my parents slowly started convincing me that dentistry is a better option. It is a direct specialization. And for women, it would be better because we wouldn't have to go out in the middle of the night to take up emergency cases. So my father would always tell me, if you practice dentistry, it'll be better. So that's one of the reasons why after my 12th, I wrote my exam and then I got into dentistry.
Doctor, it's been almost like 3 decades of practice, and I'm sure you must be having some kind of a setback or difficult phases in your life, especially the initial days. Can you please share us your journey, Doc?
Yes. When I started my clinic in 1998, I had bought all the equipments, the chair, the X-ray unit, and then it was a brand new clinic and I used to wait for my patients. So there used to be a lot of patients who were comfortable with their old dentists. They would bypass my clinic and they would go to other doctors. It was only a matter of, after a long time, they slowly started trickling in one by one, only for emergency cases or severe tooth pain. And they would just come for minor procedures. So I had to wait patiently for a long time. So initially it was frustrating because some days there were no patients at all. And there was an instance when one old man, he just walked into the clinic and he said, Dr. Susan? And I said, yes, I'm the doctor. So he looked at me from head to foot and then he said, you're too young. And he just walked away. So that was kind of shocking for me. So they felt that I was totally inexperienced. So I had to sit and wait patiently for the for the patients. And that was kind of, a setback. So it was frustrating, it was scary because after investing so much, you did not have patience.
So, doctor, who's your role model? You have reached up to this level. I'm sure you must be having some kind of a mentor. So, please share who's your role model, doctor.
Yeah, there is no doubt about it. My role model is my father. I wanted to be a doctor, and he always gave me examples of women who became doctors, who did their post graduation, and how they were successful in life. So I always wanted to achieve that. So when he told me that dentistry was a good option, so I looked towards it, and I also worked towards doing my dentistry. So, and there was one instance when I was totally upset because my classmates told me that I wouldn't be able to do carving because my hands were not artistic. Then I went back to my father and I said I wanted to quit dentistry. So that is when he told me one thing. He said, hard work and success in life is 90% perspiration and 10% inspiration. And he gave me the courage and the encouragement, and he told me that you will be a good dentist one day, and I actually trusted him. I went back, I did the carving, and my professors were very happy with me, so I was very good at carving at that time. And then, yes, I knew, my father told me, and I believed it.
I was also a very bad carver. The moment I used to submit my carving, within seconds they used to, they just break it into pieces and ask me to repeat. So of course, carving was a very challenging phase in any student's life.
Yes. No, that is true. So even before we started carving, we had all these seniors come up and scare us, telling that carving is difficult and you cannot do carving. I took it up as a challenge after my father encouraged me. I said, I will do it. So I used to go to my seniors, and they would sit and do the odd batch students, and there were some of them who used to carve beautifully. And I used to ask them tips, and they used to give those silk cloth to polish it.
Yeah.
And I really took that effort. And at one point in time, the HOD came and he just approved 2 carvings. One was mine, and the other one was, he's an orthodontist now.
Oh, great.
So, and all the others, he said, you are not taking things seriously. And that was a great day for me. Like people who told me I couldn't do carving, and then mine was one of the carvings approved. So that really gave me a boost. And I used to do carving, and then from that day I believed that yes, you need not have artistic fingers, you need to have that dedication.
So what are the things that you learn every year?
Actually, every patient is a new entity. So my father used to tell me, everybody who walks into the clinic is an image of God, and even though their problem is minor, we may think it is minor, but their problem is the biggest for them. So they may come with a tooth pain, and for us it's like, yeah, I've seen 10 cases, 20 cases just in that 1 week, but for them that is a major problem. And giving a listening ear to their problems, that is very important. And I have learned that, in addition to doing procedures, we have to be compassionate to them, make them feel special. They come with a problem, listen to them. We should have the time, even though there are about 10 to 20 patients, you have to give that time. So now over the years, initially I used to just give appointments, and then the place used to be crowded. Then I realized that each one needs their time. They would not want to just get their treatment done, but some of them would tell their problems, especially the women folk. They would come and then they would start talking about their children, the husbands, the in-laws, and we had to just patiently sit and listen to them and do a little bit of counseling, assure them, so they would feel nice to come. They would just come and spend some time. So over the years I learned that in addition to the dental care, they needed some kind of a love, attention, especially now when nobody has time for each other. They come and spend some time, and then they tell their woes, their problems, and we listen to them. That makes them feel better.
Doc, this is like truly inspiring, Doc. Especially at this era, these things, what you said is one quality which makes you a very family doctor. That no wonder patients are coming back again and again. And especially in my practice, especially when I work as a consultant, they give us a limited time, and then they ask us to complete 2 patients, 3 patients. So we won't have the time to interact with the patient and create a bond. Doctor, you're a well-known family dentist in this area, and you're well established. There's no doubt you're very successful. But how come you settled only for one clinic?
Yeah, well, I didn't want to expand the clinic. I was already spending a lot of time in my clinic. So I wanted to spend some time with my family also. So my children, as they were growing up, initially when they were very small, they used to cry when I used to leave for the clinic. And that is why I always wanted the clinic at home. But then we weren't ready for that at that time. So only when my son was in 10th standard, we built a house and I had my clinic at home, which was my dream always. So, but by the time I did that, my children learned to be independent, to get there, to be busy in their own lives. So that is what kind of worried me, because we were not spending family time together. So I thought one chair was enough. If I keep expanding, yes, I will have patients and I will be busy with them, but where is time for the family? I wanted to spend time for the family, and that is one of the reasons that I take only on appointments on Saturdays, and my clinic is closed on Sundays, so that I can spend quality time with them.
Yes, family time is very important, and yes, the patients for Dr. Susan will wait till she returns. The patients will wait, they won't go to any other clinic. So that is the power of Dr. Susan's clinic and the treatment. So this is like a dream for any dentist, to spend quality time with the patients as well as the quality time for the family. And so these are the tips which really help us to practice in the future. Doctor, so which is your favorite procedure, doctor?
Yeah, actually, I do everything. I mean, it's a pleasure to relieve the patient of pain, but then I prefer to do extractions more. I mean, a lot of grossly destructed teeth, and So when the patient comes with severe pain, swelling, abscess, and then to extract the tooth and relieve them of the pain, I mean, the result is almost instantaneous.
Okay.
You finish the procedure, and then then the patient comes back. I mean, I'm quite comfortable. I know that whenever I do an extraction, I know it will turn out well.
Okay. Every dentist, they have a special attachment towards their equipment. Like for me, I'm attached to my endomotor and apex locator. For you, doctor, any particular instrument?
All the forceps, all the extraction forceps. I have the special cow horn forceps. I know it will not slip, and I have that grip. So they're very special to me. And of course, I have my dental chair. That is my biggest asset. It is 24 years since I've had this dental chair, and I have not changed.
Wow.
Of course, I have the dealers. I have asked them in between when I shifted from the commercial establishment to my house.
Okay.
I wanted to change the chair, but one person, he looked at the chair and said, "This is a very strong chair."
Oh, okay.
Nowadays, they don't make these kind of chairs,
Yes.
and it will last. So then he said, "Okay, I can get you another chair,
All right.
and you can keep this chair. Don't sell it off. Give it to anybody."
All right.
That's when I decided I don't need another chair.
All right.
So I have my clinic. I mean, I give appointments from 10 in the morning to 12:30.
Okay.
Then afternoon I take my break, and evening again from 5 to 8.
Oh, okay.
So I think that much of time I need to spend here. The balance of
Yes.
the time I need to be in the house, cooking, doing my hobbies.
Yes.
So my dental chair is one of my most important and special equipment that.
Even I have to specially mention about this chair. So initially, I was a little frustrated because it was a hydraulic chair, and this is the only chair where this is the only clinic where I used to see this kind of chair. So I had problems, like it was like kickstarting an old scooter. It was like that. I had to stand and adjust the chair and all those things. But then over a period of time, I was like so in love with this chair, because how much ever you use it in a rough way, it is going so smooth, and I never had any complaints with this chair. I've been like working in many clinics, and it's all electrical chair, and you won't believe it or not, Doc, every week some clinics or every month they will have issue with the chair, and it's like quite frustrating, especially when you work and things don't go well, and there's a loss of patient's time. Our time is also lost. So this chair, even after certain days, I really fell in love with this chair, because this chair is only one masterpiece. You won't find this chair anywhere, even in this era. And one more thing is, even the same company which produces the latest chair, even that won't hold so good.
Yes.
When they have complaints. But this old is really gold.
I have changed the light only thrice.
Yes.
And I think that I didn't have any.
Your service also is like very very low. There was not much service for this chair. So unlike the electrical chairs, we had to regularly maintain and share a lot of money. But for this, It's like, I don't know, even I have special attachment with this chair. I've been working here for the past two and a half years. But then...
Not major problems, except for the light.
Yes. Again, so many years of practice, so many patients, so many procedures you have done. I'm sure every time things won't go according to your plan and it won't be smooth. There might be some kind of glitches which has happened, or some experience, or some traumatic experience with lost your sleep. Do you have such experience? Can you share one or two episodes of that?
Yes. So there was a man. He was from the film industry. He was a tablaist. He was just very young, 32 years old. So he came for a tooth extraction, and I just saw his thing. He looked fine to me. So he got his. I gave him antibiotics, and then I extracted his tooth. But then you won't believe it. It just started bleeding. It just wouldn't stop. So I tried to put cotton. I tried to put gauze. I got ice from the nearby bakery. I tried to put it. It just wouldn't stop. And then after that, he tells me after about 10-15 minutes, he started growing weak. I bought him juice and I was panicky. I did not know what to do. And the initial days, there were no hospitals around. So then he tells me that he was on Ecosprin. He was on blood thinners, and that really shocked me. And that is when I realized that I should have asked his medical history. But anyway, I went and got the streptomycin injection. I gave him, and he was there in the clinic for almost 1 hour. Then slowly he came back to normal, and then I sent him. But that really that night I couldn't sleep. I was awake the whole time, and there was that kind of palpitation that you get, whether he's okay. I just waited for morning, then I called him, then he was fine. So that actually gave me a lesson to ask the medical history of a patient, whether he's young or old. For me, it was like, I was just under the impression that, okay, when people above 40 or 50 will have some heart problems, cardiac problems. I never knew that this young man would be on Ecosprin. So that was one mistake, and that really, I lost my sleep on that. Then another patient was a young girl, maybe in her early 20s. She came to me, she also got her tooth extracted, and then she just collapsed. I was so scared, I did not know what to do. I kept on shaking her, and then you could make her, she just fallen. I checked her pulse, luckily her pulse was strong. Then I reclined the chair, I made her breathe, I told her, I poured water on her. She woke up and she said she had not eaten anything since morning.
Oh.
She had gone to college and she had so I make it a point. So before extraction, I keep telling them, you have to eat well before coming. So those were the two cases that that scared me. So that was a lesson for me, and I always ask the medical history. I ask in detail whether it's a small young patient or an old patient. I ask them.
Yes. So doctors, this is a very, very important message. So irrespective of the age, gender, and how much of a busy you are in your practice, you have to ask the medical history. It is your duty to ask this medical history. So please remember this, the doctors. So you have to ask the medical history. Don't just ask for the old patients. We tend to ask only for the old patients and who's physically weak and all these things. But yes, this is a very important point that you have to. Also, doc. So every year there'll be fresh dentists will pass out from their college, and they rush to open the clinic, and after some months or years they tend to close the clinic. They feel so frustrated and they can't take up the challenge. So why do you think that happens?
You need to have patience. Patience in the sense, not patience,
okay.
but patience to sit and wait for them. Like I told you initially, people used to bypass my clinic and go to their old dentist where they were comfortable. So, you just have to wait. And like my father told, every patient who walks in is not just a money bag. It is they are the image of God. They have their problems. You do your work well, people will automatically come back to you. So when they are satisfied, so you do it in a hurry, you just think, take time and do. And initially, yes, I told you, I don't know if I need to tell you this, but there was a time when I went to have my second child, and I had kept a junior dentist. She comes at the end of the month with 2,500 rupees for the entire month.
Oh, okay.
Okay, and that was quite shocking. I mean, I did not know. I had to pay my assistants, I had to pay the rent, I had to pay the electricity bill. But what is 2,500? So, and then at that point in time, I had even thought should I stop? Should I this thing? It's not working out. So, but then no, you just start doing your procedures, start doing well. People by word of mouth, they will slowly come. And after I started my clinic, I think it took me 1.5 years to get my first ortho case. There were many people who came, who inquired, who asked, and then they went back. They did not come here. They again, it's by word of mouth. See, like how you go and shop for branded clothes and or particular brand. Then new brands come, and then you're hesitant. So somebody has to go in and start. So have patience. You will surely get.
So almost 3 decades of practice. So is there any end to it? Any plans of retirement?
Yeah, I'm taking one day at a time. So as long as I can, I have my eyesight, good eyesight, and I can work, I will work. I initially had planned to retire in 2012 when I had my surgery. I was not able to even get up. So I had closed my clinic for 5 months. So we had shifted to the house also. So I told my husband that I do not want to continue. But then at his insistence, he said just keep the chair. And then we had already built a room in the house. So he said just leave it there. Anybody, you can do, you can practice or you can take care of your friends and family. So that is why I opened the clinic here at home. It was only for friends and family. That's why I don't even have a board outside. I just have my name and the name of the clinic on near the gate. So it was only for friends and family. But then it turned out that this became, a big this thing among the other patients also. So they also started pouring in, and now the practice is very good. It is not what I expected. It is much more than what I expected. So I have patients coming even from Chennai. Some of the old patients who have left this place and gone, they come back to me. So like that, I mean, I'm busy. So I don't know when I will stop. Every time I think of stopping, some new cases come up, and yes, I'm continuing. As long as I have good eyesight and my health permits me, I will work.
Thank you so much, Doctor. It's been, and I'm sure they must have learned all these things. Especially, these things are not given in any textbooks. It's only through experience or when someone personally shares these things to them. Only then they'll come to know. I'm sure many of them will avoid a lot of mistakes after seeing this video. Any final message for our viewers, Doctor?
Don't overwork. Keep a fixed timing. Spend time with your family, which is very important. And you will get patients. You will be successful. But have fun. Meet your old friends. Meet your college mates, like we do. We are planning a college get-together, class get-together sometime in July. We're all planning to meet up in Goa. So have fun, that is it.
Wow, this is truly inspiring. I'm sure Doctor is a perfect all-rounder. She takes care of the clinic, she takes care of her patients, her pets, her gardening, her leisure activities, and above all, she takes care of her family. And it's not only for this profession, but it is a dream come true for any profession, taking care of the family and profession, and this is what is very, very important. Thank you so much, Doctor, for sharing your story. And I'm sure many of the viewers will definitely thank you for this. And I hope you practice for the next 3 decades too.
Thank you.